delighted to welcome Dr. Daniel Carey, Secretary of Health and Human Resources, to This Week in Virginia. We appreciate the many times that you gave reports on This Week in Richmond on the PBS show, and we're delighted for the opportunity of talking with you. Still in a very troublesome time. In fact, as I was looked back at some of the times we talked before that maybe weren't as bad as far as the spread of COVID-19 here in the Commonwealth. So why don't you start, Dr. Carey, with giving us some update. Tell our viewers we're talking here on the 16th of the month of November, and what's the status in the Commonwealth right now?
Well, thanks so much, David, and thank you for this opportunity to speak with you and speak with your audience. And it is a challenging time. We are entering, I think, a new phase as we go into the winter months where people are not outside as often. They're not able to eat outside and maybe don't have their windows open as much. So that we think that is likely a significant way in which this virus, COVID-19, is spread. So right now, the last 2 days, we've had over 2,000 new infections, individual Virginians with new infections reported out during the previous 24 hours. So that is a significant increase. So while Virginia is nowhere near as in the same situation as other states, it is very concerning. It is a very disturbing trend, and one which we need to, as a people, as a Commonwealth, respond to. So some states are in the hundreds in terms of the number of new individuals with infections per day per 100,000 population. That's how we normalize the numbers across the different states and different countries. We're in the lowest 5 states or so, but that's little solace when we see increasing infections in Virginia, increased folks who are dying in Virginia from COVID-19. So this is entering a new phase, a worrisome phase that we need to work on together until a vaccine is available to really stop the spread of this pandemic.
I noticed that I've referred to this as the 16th of November. I do believe it's the 17th, but we thank you for that update. Someone has said during this pandemic era, we don't really have regular days of the week. We just have yesterday, today, and tomorrow. So this is today that we're talking, but it is the 17th.
Well, I just to build on that, just a little bit, I very much in my life, I think about, that was before COVID-19. Oh, that I met with that person last face-to-face. It must have been February. Oh, yes, because it was face-to-face. It was pre-COVID-19. So I think it is really something that will endure for so many of us because it's such an incredibly impactful situation and challenge that we are all facing.
You know, when we conversed before, and I was looking back at some of my notes, and what was true then is very much true now, that in your work as a physician in the Lynchburg area, that you have been passionate about expanding affordable health care for Virginians. And in this time that we're living right now, that's got to be even more crucial than it was 12 months ago.
Well, David, I just cannot imagine where Virginians would be in 2020 had we not, as a Commonwealth, both houses of the legislature and the governor coming together to pass Medicaid expansion. Now over 480,000 Virginians newly covered since 2019 by Medicaid expansion, getting access to medicines and evaluations, and to give them the security that if they need to be hospitalized, that they will not be financially ruined. That doesn't mean Virginia doesn't have any individuals who are uninsured, There's still many hardworking folks that make a little bit more than are covered by a little bit more than put them out of the range that's covered by Medicaid expansion up to 138% of the federal poverty level. But let's make no mistake, this was an incredible achievement by all Virginians and by all branches of government to achieve this. And even the 75,000 or so Virginians who are newly covered during the pandemic, what a resource that is in peace of mind to seek care, seek testing, and the like. So incredibly important lesson. And I think it's important to realize that in 2019, Virginia was the only state that did not have an increase in the uninsured rate in their state. So, and that was largely because of, one, the financial vitality of Virginia, a great economy in 2019. Fortunately, we had a great economy going into the effects of COVID-19, so that we started at a strong place and are somewhat better able to weather this. But that was a factor, and then Medicaid expansion was a factor. So incredibly important. And I hope one of the long lessons that we learn, not just as Virginians, but as Americans, that universal health insurance, a basic, decent minimum coverage for all, has got to be a goal that we share across this country, because it only makes sense. It only makes economic sense. And this pandemic has made that so clear.
And watching national news, it seems like every day there's multiple stories about exhausted healthcare workers, no matter which of the 50 states that you're in. I'm sure here in the Commonwealth, even though, as you said before, it's not as bad as in some other states as far as the rate of ones being hospitalized or the rate of the spread, but there's got to be folks that are just tremendously exhausted. And how are your colleagues holding up? How are you holding up, and your colleagues as well, during this time?
Well, thank you very much, David, for that question. I do check in with my colleagues back in Lynchburg. I check in with the heads of the health systems around Virginia periodically, try to call several each week, check in with the Medical Society of Virginia leadership, check in with the Virginia Hospital Healthcare Association leadership to get a pulse, because I'm reticent to go visit. I have made a few visits, but I don't want people gathering to receive my office, not me personally. Sure. So I am dependent on Zoom, like we are now for this interview, when I check in with people or with a simple phone call. So Virginia healthcare providers are definitely feeling it, and they are hurting. And I am very concerned about that. I would also note that if we were to talk to teachers, if we were to talk to frontline workers, if we were to talk to behavioral health workers, in addition to out in the clinics, that there is great fatigue, partly because the changes in our life, partly because of the economic stress, partly because of the worry of what's going to come next. How are our parents and loved ones doing? I have a 90-year-old dad that is in an assisted living center down in Florida, and I was not able to visit him for almost 10 months. I was able to make a visit several weeks ago and made it back safely, and he has been safe. But that is just what so many Virginian families are feeling. So yes, it's in the healthcare system, but there is a baseline level of fatigue that we all have. And I think that's contributing to, I think it's been described as our fatigue to wearing masks and hand hygiene and 6 feet of distance and staying home when we don't feel well. But despite that fatigue, we've got to persevere. We've got to endure together. Now, with regard to our healthcare workforce, I think it is a level of acuity even above that, because we're seeing, even though all of Virginia is not as stressed as other parts of the country, Southwest Virginia, as we're seeing rates of infection of 40. The average in Virginia is 16 or 19. In August, it was 8, maybe cases per day per 100,000. But in Southwest Virginia, it's over 40. Far Southwest, it's over 40. And Ballad Health, the primary health system, is feeling the stress. And when I talk to the leadership at Ballad, and this is really true for all of the health systems in Virginia, they say, Dan, it's not the beds. We can create bed spaces. It's not the PPE right now. We are able to stockpile over the intervening months what we think we will need for the surge. I hope they're right about that, by the way. Not 100% sure, but we'll see. They are worried about, Dan, I'm not sure I have the nurses. I'm not sure I have the respiratory therapists to staff the ER, the emergency room, to staff the intensive care units, to staff the medical surgery wards. And that is the challenge. And we've had in other national disasters or emergencies, it's been in one state or one region where Hurricane Katrina hit, or we had even Hurricane Florence come through North Carolina 2 years ago. But this is everywhere. So we can't call the National Guard in another state and get assets. We can't call other health systems around the country and say, please send us your doctors, your nurses, your respiratory therapists, all the team it takes to take care of complex medical patients. So we are having to solve this, I think, on our own, and we're going to have to support our healthcare workers in every way possible.
You know, in a previous time, there was a big effort to try to get people who were either retired, people who were trained, who had a license in one of the specialties, who were not actively working right now. Has that helped some, or is there still a call that needs to go out to those who maybe have the education, the training, and even the licenses to say it's time that you're needed?
Well, that you're referring to the Virginia Medical Reserve Corps, and I think that has been a real success story here in Virginia. And there's been 2,200 licensed healthcare professionals that have stepped up as part of the call for help in COVID-19. And those nurses and, again, respiratory therapists, CNAs, and physicians have volunteered to support outbreak investigations in numerous regions in Virginia, and contact tracing, public health information, as well as community testing events. And I will thank my wife, Kim, who, when she was furloughed from she's an RN and furloughed from her clinical research role, she did several months of several days per week of contact tracing with the Department of Health here in the Richmond area before going back to her regular position. So that has been an example across the state. That is different, though, to fill the gaps for a short period of time compared to what may be needed is a prolonged surge response. So yes, we still want your listeners to go on to www.vamrc.org, the Virginia Medical Reserve Corps, vamrc.org, and sign up. We always could use more volunteers, but having a reservoir of fresh, trained nurses ready to jump into an emergency department, able to jump in and staff an intensive care unit is a little bit different as compared to disaster recovery. And so our volunteers are so very much appreciated, and please volunteer, but it won't solve all of our needs, and we will need to continue to support our health systems and our nurses as best we can, knowing that the full cavalry is likely not coming, that we've got to. Medical Reserve Corps, very important. If you have those skill sets in particular, please volunteer and you're available. And at the same time, yes, that is greatly needed and appreciated, and yet it likely won't, over the long haul of the next several months, meet all of our needs.
If we shift to something that maybe is a bit even more positive than some of what you've been able to talk about, that is the word that we're getting about some vaccinations that may be coming here toward the end of the year, the early part of next year. There seems to be some concern out there around the nation among states about whether states will be prepared to, once the vaccinations are available, to get them out to the most vulnerable people that need to receive them. I know that you and the governor have some money that was set aside from the CARES Act to help in this, but what's the word about what's happening here in the Commonwealth when the vaccinations are available? What will be happening?
Sure. Great question. The governor did set aside $23 million of the CARES Act funds that need to be spent by the end of the year. We didn't expect large quantities of vaccine to be available in 2020. We do very much expect it to be available in 2021. So that was to get us kick-started on our preparations, in addition to other resources that the Virginia Department of Health have. So just a little bit on the vaccines. I think we heard last week that Pfizer, in conjunction with a German pharmaceutical company, reported their preliminary, now that's important to remember, preliminary data on their vaccine, but it looked like it had a 90% effectiveness, meaning of the group that, for example, of the thousands and thousands of patients that got the vaccine, only 1/10 the number in the group that got the vaccine got the infection compared to those that didn't get the vaccine. So that's a dramatic reduction. And that's better than the flu vaccine, although we want everyone to get the flu shot, because even if the flu is 60 or 70% effective at preventing flu, that's a dramatic reduction in flu infections, especially for those that have chronic diseases and may have life-threatening complications. Fast forward from last week to this week, we got news that Moderna, another pharmaceutical house in conjunction, I believe, with Oxford University in England, their results suggest a 94 or 95% reduction in infections. And that is the kind of reduction you get from a measles vaccine. And, almost all Americans accept the measles vaccine as safe and effective. So if these vaccines are indeed proven safe and effective, and by the way, we've had relatively few reports of adverse events. So I have every expectation that they will be shown to be safe in addition to effective in the additional analysis. We do expect them to be available. Likely, we heard from the federal government and the Project Warp Speed people that we could expect some doses in Virginia, maybe several 100,000 doses before the end of the year. So that's very exciting. We will be ready in Virginia, the Department of Health, working with the Department of Emergency Management, working with health systems across the Commonwealth, and also signing up clinics and doctors' offices and federally qualified health centers and free clinics and other places, some universities that want to be registered vaccinators. And so we've had hundreds and hundreds of sites across the Commonwealth volunteer and say, yes, we're ready to receive vaccine, and we can give the vaccine, and we can keep track and report in the necessary way to keep track of who got which dose. Because remember, most of these, all but the Johnson & Johnson vaccine is a two-dose regimen, one dose, two doses spread out by about a month. So we will need to keep track. You'll need to get the same vaccine the second time that you as an individual got the first time. So that's really exciting. We are concerned about the cold storage. Several of these vaccines need ultra cold storage, dry ice cold, -70 degrees Celsius or more cold, not just simple refrigeration or a simple freezer. So we are in the process of assessing and making sure that we have the necessary storage facilities. As it turns out, the Moderna could be stored with normal refrigeration for 30 days. So that will make the logistics of that much easier. So yes, there's lots of infrastructure, lots of planning, and the Department of Health and the Department of Emergency Management, in fact, this week is going to give the cabinet and the governor a briefing this week on where we are with regard to those preparations. So we will be ready. And then the next question that you ask is very important is, there's going to be limited vaccine initially. So we have to prioritize, just like we did with testing and just like we did with some of the initial treatments like remdesivir. We had to allocate it on a rational basis and a fair basis with that equity lens in line. When it comes to vaccines for COVID-19, we have to make sure that our healthcare workforce and those first responders are protected, because if they're not protected, then they're not going to be able to help the rest of us. And then the next group we would be looking at is those most vulnerable. That would be our folks in nursing homes and assisted living, the elderly, those with chronic medical conditions, and populations that are chronically underserved. We've seen the increase in infections and also deaths in the African American population and also in the Latinx and Hispanic population. So we need to make sure that those that have that are the most vulnerable are prioritized to get the vaccine first. So there are some federal guidelines, but also state guidelines. Our Health Equity Working Group is part of those discussions. Our health systems are part of those discussions. In fact, there's 70 or 80 or 90 people on the vaccine planning group to make sure that all voices are heard and that we use the vaccine and get it out in the most fair and appropriate way, knowing who's vulnerable, and especially for healthcare workers, because they are most vulnerable taking care of patients who have COVID-19 themselves. So the other part of that is that we want to make sure that people want to get the vaccine. There has been a challenge of trust based on what I would call the politicization by the federal government, by the Trump administration, of what we would have considered in any other Republican or Democrat administration, fact-based, science-based organizations like the FDA, like the CDC. And we need to get back to that. And because of that politicization of those groups, I think that the public trust has been reduced. And we need to lead by people like me and the governor and healthcare leaders and ministers from the community and other elected politicians and the like. We need to, when this vaccine is proven safe and effective and is available, we need to get it, and we need to show that it's safe and effective. And I would encourage all your viewers to get their flu vaccine and then look at the data like we will look at the data of the vaccine, and when it's shown to be proven safe and effective, encourage everyone to get it as soon as we possibly can get it from the federal government that will be doing the initial distribution.
Well, Dr. Carey, thank you so much for the report and the information. Look forward to getting back with you again soon and getting more information. In the meantime, we will be getting our mask back on.
Yes, indeed.
And making sure that we stay safe. And I thank you very much. And stay well, stay healthy, and keep leading the charge. Thank you, sir.